Dr. Vincent Schaller is the President and Medical Director of the Hockessin Walk-In Medical Center, which sees more than 14,000 patients every single year. With more than 17 years of experience, including inpatient and outpatient medicine, ER, pediatrics, and gynecology, he's been recognized by Delaware Today as a top doc. The center has trained more than 100 interns in 6 years and participates in the healthcare and education of local schools and sports leagues and works daily with school nurses, coaches, and trainers. Please welcome Dr. Vincent Schaller.
Hi again, today's lecture is going to be on concussions. I'm going to talk to you about what a concussion is, how to identify it, and how the doctors are going to be treating it. I'll try to stay on time with my 15-second slides. Concussion is pretty much like the brain is a soft pizza dough, and the skull is a hard rock. The questions that you would like to know about concussions for saving lives is that 1.7 million brain injuries occur per year from accidents in sports. About 52,000 deaths result from that. As the picture shows you, pizza dough uncooked is like the brain, and the skull is like a hard rock. When the head hits any object, with or without a helmet, then you end up having a problem with a bruise of the brain. Like a bruise of the ankle, it takes about 48 hours, the brain swells up, and the brain swells down. There's 3 levels of concussion. Mild is known as when your bell gets rung, confusion lasting less than 30 minutes, and it's a solid hit to the head. With a mild concussion, gang, you're not going to necessarily see a bruise or scrape on the skin, so a mild concussion is by symptoms. The second kind of concussion is a moderate concussion, where you see the athlete sees stars or is dazed. There's no loss of consciousness. That's a mild headache or a confusion lasting for greater than 30 minutes. And the amnesia that could occur from this milder concussion is less than 24 hours. Third kind of concussion, third level, severe. The athlete is technically knocked out. Any loss of consciousness with or without nausea, vomiting, or memory loss. So truly a severe concussion is when the athlete's having a hard time getting up off the field or off the court. How do you identify some signs of concussions? The athlete may be staggering, may be unresponsive, confused, sudden loss of coordination, vomiting, dizziness, just hard getting up off of the court or the turf. If you think about a concussion, it's truly something that you would look from the sidelines and try to see if there's a problem. However, if you're the parent, the coach, or the athletic trainer, or the doctor for the team, you want to pull the athlete out immediately to the sidelines. If it's a severe concussion and there's no physician available, you're going to want to elicit 911 to get to a local emergency room. If it's a mild or moderate concussion, you're going to pull them out of the game. And why are those concussion athletes put back in? There's many reasons. Be one of the best athletes on the team, maybe some parent pressure, maybe some coach pressure. Sometimes the athlete themselves puts pressure. And it could be an important game. So many times I get that, but Doc, tomorrow is the playoffs. If you remember what happened to Tasha Richardson, Liam Neeson's wife, she had a skiing accident, just banged her head lightly, refused any work up at the ski slope by the medical team, and she ended up then driving home, and by the time she realized she had symptoms, it was too late, brain bleed, and she passed away before the ER could help. You would go to the emergency room if you experience an accelerating headache, vomiting, if you have any problems with persistent confusion or increasing sleepiness, family should take the patient directly to the emergency room. When you get to the emergency room, what they're really looking for is, do you have a brain bleed? CAT scan's painless, there's no IV, it takes a few minutes, and they're going to figure out whether there's a bleed in the skull. If there is a bleed, they're going to admit you and observe you. If the bleed creates pressure, there may be surgery to relieve that bleed. If the CAT scan, the ER says you're fine, you have to go home with your family. Family still has an important job overnight, is to wake you up about every 1 to 2 hours. And when they wake you up, they're going to be asking you a simple question. And also we teach our parents to be checking the pupils. If the pupils large or blown or the 2 different sizes, it's a situation where they have to go back to the emergency room or call their doctor. What to expect after a concussion if your child has a concussion or athlete you know. They're going to be fatigued. It's okay to sleep after concussion as long as the neurochecks are all fine. But you're going to notice they experience increasing headaches for days after the actual injury. In the days following, you want your athlete to rest. It's very important that they rest until all the symptoms are gone. This would mean for them to avoid reading, texting, working on the computer, get lots of rest, fluids, kind of what you would do for flu-like symptoms. As far as the repeat customers, that's the biggest problem. If you look at the listing, a second concussion, if it's mild, the athlete's out of sports for 1 or 2 weeks after the symptoms are gone. If it's a moderate concussion, they're going to be out for an entire month. You've seen some of this like with Brian Westbrook about 2 years ago with Eagles. Severe concussion, they're gone for the season. In follow-up, we do recommend that the athlete gets at least one doctor visit. There's a bunch of follow-up things the doctor's going to be checking for. May want to send them to a neurologist. May want to do some neurocognitive testing. One of the companies that does that right now is the Impact Company. It's a 20-minute neurocognitive test. Follow-through is very, very important. Doctors can use some safe medications that can help the bruised brain to heal. The doctor can instruct the school how to pace the athlete's homework, testing, and do not ignore those symptoms as the parent or the family member of an athlete with a concussion. Lessons learned from past tragedies, the parents really need to be the patient's advocate. If the coach or trainer is sending them back into a game or practice with a head injury, you need to confront that coach or athletic trainer. You want to track the symptoms, ask them daily at home how they're feeling, how their headaches, and really have to continue communication. In the future, laws may actually help solve with some of the problems of concussions. A lot of states are looking at mandatory preseason neurocognitive testing, also looking for the testing before the concussion as a baseline, and then after the actual concussion occurs. And then hopefully return to play guidelines will become law as well. So regarding concussions, it's very important. We're learning a lot, probably mostly through our professional athletes. It becomes much more publicized. But these kind of injuries are very common in the high school realm, the college realm, really any contact sport.